Mr. Speaker, it is with great pleasure that I rise this morning to share with my honorable colleagues the government's 5-year national plan for adults with intellectual disabilities 2023 to 2028. This is a first for Bermuda. Additionally, Mr. Speaker, this 5-year plan has been transposed into an accessible version, a direct reflection of the government's plan, not just to develop a plan and implement it, but to be inclusive so that persons with intellectual disabilities are involved in the implementation of the national plan. This is truly exciting work. Mr. Speaker, the month of March is celebrated as Intellectual Developmental Disability Awareness Month in Bermuda. Last week, Friday, March 17th, I joined with the students and staff of the Dame Marjorie Bean Hope Academy in a walk, ride, roll annual event held at the National Stadium Northfield to educate Bermuda about Dame Marjorie Bean Hope Academy School and students. The principal and her team adopted and adapted the U.S. recognition of this month to reflect the unique profile of the students served at the school. The event was satisfying to see our students with disabilities enjoying themselves and engaging in the fun event. Mr. Speaker, also in recognition of the significance of this month, yesterday I held a press conference to announce the launch of the National Plan for Adults with Intellectual Disabilities and their families. In attendance were some of the members of the Planning Committee for the development of this plan, who was represented Tomorrow's Voices, WinReach, Mid-Atlantic Wellness Institute, Dame Marjorie Bean Hope Academy, Aging and Disability Services, K. Margaret Carter Center, and the Disability Advisory Council. Mr. Speaker, this 5-year plan, also referred to as the National ID Plan for Adults, aims to ensure the well-being of adults with intellectual disabilities and their families through a coordinated approach of activities. Mr. Speaker, let me take this opportunity to give a better understanding of intellectual disabilities. The Special Olympics website states there are many kinds of intellectual disabilities and many causes. Intellectual disability is the most common developmental disability. According to the American Association of Intellectual and Developmental Disabilities, intellectual disability is a condition characterized by significant limitations in both intellectual functioning and adaptive behavior that originates before the age of 22. Intellectual functioning refers to the general mental capacity, such as learning, reasoning, and problem solving. Generally, an IQ test score of around 70 or as high as 75 indicates a significant limitation in intellectual functioning. Additionally, adaptive behavior refers to significant limitations in 2 or more adaptive areas or skills needed to live, work, and play in the community, such as communications or self-care. And Mr. Speaker, persons with intellectual disabilities can have a wide range of needs due to cognitive challenges, but they may also have many strengths. It is estimated that there are 500 Bermudians with an intellectual disabilities, with over 400 of these persons, or 80%, who are 18 years or older. Therefore, based on this, as our children with intellectual disabilities grow in age out of existing services, it is essential that as a country we appropriately plan for and support their ability to thrive as adults in the community as they age. The intent of the National ID Plan is to empower adults with intellectual disabilities and their families to ensure they live happy, healthy lives. Mr. Speaker, at the heart of the National ID Plan and its priorities are adults with intellectual disabilities and their families. This means, as a community, we cannot simply acknowledge and do for this population group, but we must actually listen and do with them. To make this happen, the accessible version of the National ID Plan will be used to enact the principles of rights, independence, choice, and inclusion that it is based upon. Mr. Speaker, to achieve its purpose, the National ID Plan has 5 key priority areas and objectives. These are quality support and services to ensure high-quality person-centered supports for adults with disabilities and their families are readily available. 2, training and education for support workers to ensure informal carers and staff who support adults with disabilities and their families are well trained and can access specialist advice easily. policy, regulation, and accountability to ensure a legislative framework, policies, and governance arrangements are in place to guarantee the protection of adults with intellectual disabilities, monitor the effectiveness of the plan, and oversight of matters that impact their lives. Financing to ensure services and public funds are well managed and public finances are effectively used, that families have access to the financial help to which they are entitled and can access the services they require, that health insurance benefits are used effectively to fund care, and financial incentives are in place to care for loved ones at home. Advocacy and communication to ensure family carers and adults with intellectual disabilities are empowered to influence how services are developed and managed, and to ensure accountability of services to adults with disabilities. Mr. Speaker, the next steps for the plan is implementation. The Ministry of Social Development and Seniors is establishing a cross-ministry and sector governance steering committee that will oversee the implementation of annual action plans to ensure accountable and coordinated activities by identified working groups that are committed to keep adults with intellectual disabilities and their families at the center. This includes having representation and input from persons with intellectual disabilities and their families at all levels of implementation and government and the governance process. Mr. Speaker, the creation of the National ID Plan for Adults was spearheaded by the Mid-Atlantic Wellness Institute in partnership with the Ministry of Social Development and Seniors. This leadership was supported by a dedicated cross-sector planning committee who collaborated their professional and technical skills to develop a comprehensive national ID plan. I extend my gratitude to the members of the committee for the time invested, the dedication, and the passionate energy they displayed to see this plan fully completed. Ms. Marissa Rogers, Mid-Atlantic Wellness Institute, Ms. Kiuna Balbuda, Aging and Disability Services, Ms. Sarah Delasio, Aging and Disability Services, Ms. Jennifer Howard, K. Margaret Carter Center, Ms. Veronica Baptista, former administrator at the K. Margaret Carter Center, Ms. Julie Lynn, school social worker at Hope Academy, Dr. Alec Bush, clinical psychologist, Mid-Atlantic Wellness Institute, Intellectual Disability Services, Ms. Tina Nash, Winreach, Ms. Margaret Phillips, Dame Marjorie Bean, Hope Academy, Ms. Thea Furbert, Tomorrow's Voices and Parent, Ms. Tony Bridgewater, Community Advocate, and Mr. Jose Lopez, Parent and Community Advocate. I also, Mr. Speaker, I extend thanks to all the stakeholders and general public who participated in the public consultation and meetings that were held. The input and feedback obtained from them helped to ensure the plan was well informed. Mr. Speaker, in closing, I must emphasize that although intellectual and developmental disabilities is recognized in Bermuda during the month of March, as a community we must maintain this focus and awareness throughout the year, as there is much work to do to create and become a more inclusive society. The National ID Plan for Adults with Intellectual Disabilities is one of the key means to help achieve such. The 5-year plan is another step towards advancing the country to better align with the UN Convention on the Rights of Persons with Disabilities in anticipation that it will be extended to Bermuda. Mr. Speaker, I encourage our community to become familiar with the National ID Plan for Adults, which can be found on the Ministry of Social Development and Seniors homepage website located on www.gov.bm. Bermuda, I look forward to your support of our adults with disabilities by staying engaged with initiatives that will evolve out of the National ID Plan. In this way, you can be a part of the change in making Bermuda more inclusive. Thank you, Mr. Speaker.